Hello, everyone. My name is Monty Ledbetter, and I'm a nurse practitioner student at Auburn University. And I'm going to talk today about the pharmacology class of drug known as nitrates. The most common drug in this class is nitroglycerin. The action of nitrates is that it affects both oxygen supply and demand to the myocardium by providing more nitric oxide to the vascular epithelium and arterial smooth muscle, resulting in vasodilation. Some of the therapeutic effects, it produces rapid relief of acute angina, decreases cardiac workload, and decreases platelet aggregation. Some of the pharmacodynamics of nitrates: it causes vasodilation in the systemic vasculature. In the heart, it reduces preload and afterload. And in the coronary vessels, it prevents and reverses vasospasm. Nitrates are absorbed by oral, buccal, sublingual inhalation, and transdermal routes. It is widely distributed throughout the body. Oral nitrates have a significant hepatic first pass, but primarily it is metabolized in the liver and excreted through the urine. Some adverse drug reactions: it causes hypotension, tachycardia, and throbbing headache. Some other side effects are nausea, vomiting, incontinence of urine and feces, dysuria, impotence, and urinary frequency. Some of the drug interactions are an additive hypotension with other drug classes that cause hypotension, drugs with anticholinergic effects, decrease absorption. Aspirin increases nitrate serum concentrations, and the effects of heparin may be decreased with nitrates. Precautions when using nitrates are with glaucoma, volume depletion, anemia, and hypotension. Some of the contraindications are hypersensitivity, and patients with head trauma or cerebral hemorrhage. The pregnancy category for nitrates is C. And with intravenous forms, you do not use it with cardiac tamponade, restrictive cardiomyopathy, or constrictive pericarditis. The clinical use for nitrates is for all three types of angina and in some subsets of patients with heart failure where the pathology is increased preload. The rational drug selection focuses on formulation and cost, and there is no laboratory monitoring with nitrates. Patient education with nitrates: they do need to take the drug as prescribed. With oral and transdermal doses, there needs to be a free interval of 10 to 12 hours to prevent tolerance. Do not crush or chew sustained relief tablets. When opening a new bottle, you need to date it and replace it after 6 months. Sublingual doses do not need to be swallowed. The drug should not be used concurrently with alcohol. Also, to treat the headaches caused by nitrates, it's best to use Tylenol. Some of the lifestyle management changes that need to be made is slow position changes to minimize blood pressure issues when using nitrates. Some of the main takeaways about nitrates: patients with migraine headaches are at high risk for nitrate headaches, so you might want to start them on a beta blocker for headache prophylaxis. Do not use nitrates with drugs that treat erectile dysfunction. And some of the overdose symptoms for nitrates are slow heart rate, vision changes, severe nausea and vomiting, sweating, cold, clammy skin, and bluish fingers and toes. And my Dr. Moore meme for this PowerPoint: I've been told that when I get really focused on homework at the house, I can't hear a dump truck driving through a nitroglycerin plant. Thanks for listening, guys. Have a good night.